Good morning, everybody. I'm Robin Wittenstein. I'm the CEO here at Denver Health, and I want to start out by saying thank you for your interest in this topic, and thank you for your continuing support of Denver Health and the work we've been doing. We know that the COVID pandemic has been going on for a very, very, very long time, and that there have been a lot of twists and turns along the way. And most recently with the development of the Omicron variant and then the way that has affected all of us, there have been a lot of questions that have been raised and a lot of issues that people are just uncertain about or confused about. So in the spirit of trying to put out as much information as we can and answer questions, we decided to hold another COVID briefing just to be able to give you some basic information and actually give you the opportunity to hear from a real expert. So I'm delighted today that Dr. Connie Price, who is the Chief Medical Officer here at Denver Health, an infectious disease physician, and honestly a national expert on disaster and emergency preparedness, has been deeply involved with the federal government and the state government on planning for and dealing with the COVID crisis. She can provide a lot of information, and I am sure she'll be able to answer all of your questions. So as we go along, if you have questions, please put them in the chat box, or later on there is a way to unmute yourself to ask questions, and as soon as somebody tells me what that is, I will tell you what that is. So with no further ado, Connie, if you want to jump in.
Well, thank you. It's an honor to be here with you all today. And I was asked to speak for the next 10 minutes on just to provide an update on what is happening with COVID-19 in our community, particularly our metro area. So what's different with this wave? What's the same? So let me just give an overview what we're seeing with rates. So starting at the end of December, our community saw a huge increase in case counts of COVID-19. And that was largely due to the emergence of a new variant known as Omicron. The Omicron variant was found to be much more transmissible, though less severe, particularly in those who have been vaccinated, and particularly in those who have been vaccinated and boosted. So what that meant in our community is that we saw a huge increase in people being diagnosed. But because of the extreme numbers of people being diagnosed, we also felt it on the hospital side, not because it was more severe, but just the sheer numbers of people who were coming positive with COVID, many of whom remained unvaccinated. And so that, from the hospital perspective, meant that we were seeing patients coming into the hospital on top of an already high census from people coming in with deferred medical conditions, more acute needs for their medical conditions, and remaining COVID patients from the Delta variant that we were still taking care of, and now this new wave of Omicron. So our staff have felt the burden of this, even though it has been less severe in terms of the disease it causes. With that, we also are in the context of this great resignation where healthcare workers have been disproportionately affected and many have left the field. So we're doing all of this with more staff shortages. The good news is, with the Omicron variant, though it went up incredibly quickly, it also is starting to come down incredibly quickly. And we're feeling that relief in the community, in what is being diagnosed in the community. And in the hospital, I think we'll soon start feeling that too. Although on the hospital side, it's a bit delayed because we still have patients who are recovering. But I'm confident we will start feeling that as well. We are pleased that a high proportion of our community in Denver is vaccinated, and Denver Health has played a huge role in that. We've given over 300,000 doses of vaccine to contribute to an over 80% rate of vaccinations among all comers in Denver community. And that's really important because we know that vaccine 2 doses and especially 3 doses of the mRNA vaccines are incredibly protective against severe disease and protective against death. So it's an important contribution that Denver Health has made to the health of our community to be able to have vaccinated so many people, to have kept this manageable for our healthcare system and saving lives. In addition, we've been on the front lines of providing therapeutics that now exist for COVID-19. So many of you may have heard about the monoclonal antibodies. And for many weeks, we were the only institution providing monoclonal antibodies for patients who were at risk for severe disease but didn't quite need hospitalization. We were able to prevent some of those hospitalizations and likely some of those deaths because of our ability to give these monoclonal antibodies. And then as we had the emergence of the Omicron variant, which was no longer affected by the 2 widely available monoclonal antibodies, we quickly pivoted to get the one available monoclonal antibody that's effective against Omicron. It's called sotrovimab, and we were able to start administering that at Denver Health. We asked for the help of our federal government to provide reserves to help us administer these antibodies at our Pena clinic and then at some sites on campus. In addition, we got the antiviral Paxlovid that has been effective in also preventing hospitalization when given early in the course of disease for those at risk for progression. And we are now administering preventive antibodies for people who don't respond to vaccine to prevent those vulnerable populations from getting ill. So with all of these things on the horizon, with a variant that seems to be evolving to be less severe, we see a light at the end of the tunnel. Though our work is not done yet, we see a light, and we're happy that we are able to provide all the therapeutics for those breakthrough and for those who are so vulnerable to severe infection. The Omicron variant BA.2 is a subvariant, a descendant of the original Omicron variant that we have been seeing in Colorado and that we have seen in Denver. And it probably will quickly take over as the predominant variant here. But and though it may be more transmissible, the good news is it doesn't seem to be causing more severe disease. And I think it's a reflection of this just continuing to evolve. Looking at other countries who have seen this subvariant, such as Denmark, they have seen another surge in community cases, but not as much of an effect on the hospitalization. So even though we're seeing this subvariant in Denver and in Colorado, we do think we can manage it, and especially with all the therapeutics that we have available at Denver Health and the widespread vaccine efforts, we're confident that we can weather that storm as well. And especially with the help of generous people like yourselves who've been supporting us through all of this. To prevent infection, we still continue to advocate for the measures we have throughout this pandemic. Vaccination, particularly boosters, all of us should be getting boosters, and masking in areas where you're going to be around a lot of people. And to help prevent infection to others, masking when you're around others who may be vulnerable, especially to severe infection. Hand washing is always a good intervention as well, just like it is for containing any other communicable infectious disease. So I think our long-term situation, we've long been trying to predict how this pandemic will end, how we'll get out of it. And it appears that the way this will end is that this virus will continue to evolve and mutate to become one of our regular respiratory viruses that we see every year, like the common cold, that we see like flu. And I don't know if it will have a seasonal increase or not. We don't know that yet. We don't yet know about the durability of our vaccines, if we're going to need a booster, if we're going to need a different vaccine. That remains to be seen. Some of it depends on how we see this virus evolve. And it may be that it becomes kind of what I would call a nuisance virus that will cause the sniffles periodically throughout the years that this will continue to evolve to. So we have to hold tight, act on the data, and follow our national guidelines on how to best control and prevent infection with COVID-19 in a post-pandemic world. And I think with that, Shelley, do you want me to take questions at this point? Have I hit on all of the things you wanted me to?
I think so. Well, we have some questions that were
Excellent. Okay.
And I think one of the things that has been so difficult with this pandemic is just not knowing what's going to happen. And so a lot of the questions I get asked, and some of the things that have been submitted in advance are, we can't really predict, but it feels as if there's pathways in front of us where this could become just a common cold sort of virus. It could be more like the flu, which, while we don't go into lockdown because of the flu, tens of thousands of people die every year because of it. Or alternatively, another strain of the virus could come forward that isn't quite, maybe equally transmissible, but perhaps not as mild as this one seems to be for the majority of people. Any sense of and I know you just said we can't predict, but the concern in particular is there's so many people who aren't vaccinated. Is that really just providing a pool of subjects for the vaccine to experiment on until it comes up with something else? What do we need to be looking for to understand what might be coming at us?
Well, I think we need to continue doing the surveillance we've been doing and staying alert and situationally aware of what's coming out. So, one of the examples is our public health colleagues have been testing wastewater for new variants, and it's a great way to get a concentration of potential viruses and get that first alert to what might be going on in the community. So I think we'll need to work with our public health colleagues to continue doing that kind of work. But if there's a brightness in any of this, I think it has given all of us a new respect for communicable diseases, particularly the common upper respiratory infections. And we have to remember, in our pre-pandemic world, people were hospitalized frequently with severe infection, and we did see deaths from influenza. We saw deaths from RSV, from parainfluenza in the right population. And so I think we all have a better respect for how to prevent transmission of these infections, and knowledge that people can get sick from these things. And COVID-19, I think, was a reminder of that power, and also evidence that we can get through it. We can overcome it. And there are public health measures, there are basic measures that can help save lives. And we'll continue to do that.
So a question about testing. We've gone, again, ups and downs with testing, where it was available, it wasn't available. Now there are home testing kits, and the question is, are they accurate and effective or not? We're seeing some supply shortages again when it comes to testing. What should people be thinking about when they think about testing? Should they go in? I know we tell people, please don't go to the emergency room just for a COVID test. But should they be going to their doctor's office to get a PCR test? Should they use at-home tests? Should they just, if they're not feeling well, stay home? And how is that going to affect our understanding of the transmissibility of this if we don't really know who has or doesn't have COVID?
Well, I think as we shift to a new normal, we go by the principles we've always been promoting, which is, if you're sick, stay home. Right? You don't want, whether it's COVID-19, flu, or some other virus, we don't want to spread it to others. But when we need to have a diagnosis, if we are a patient or our loved one is somebody who might benefit from one of the therapeutics that I mentioned, then it would be a good idea to get tested. The rapid tests available at the drugstore or available for free from our state health department are great, convenient tests that we can do at home. And they are generally when they're positive, it's a pretty good, it's a pretty good assurance that, yep, that's COVID-19. Sometimes, more often, they'll give a false negative than a false positive. And if you are an at-risk patient or your loved one is at risk for severe COVID-19 and they really are displaying symptoms that are consistent with what could be COVID-19, and they are at risk for severe infection, you may want to seek a test at your doctor's office to follow up a negative result just to make sure. Because if we know it's COVID-19 and there's a therapeutic available, then that's when you'd really want to know. So, but I think as we go on, into a new normal, and if this, for most of us who are now triple vaccinated, if this really is more of a nuisance infection, it may be that you stay home while you're sick and then go back to work when you feel better, just like we did before the pandemic.
Well, unfortunately, that wasn't always the case.
Well, okay, looks like
but
we should have done.
It's good advice. If you don't feel well, stay home. So.
Yeah.
If people on the phone have questions that you'd like, you can either put it in the chat box or press *6, and that will unmute you, and then you can jump in and ask questions. One thing that I'm wondering about, we're about to end the mask requirement here in the county of Denver, and Denver, the city and county of Denver has actually been pretty good in terms of both getting vaccinated, following masking, hand washing, physical distancing, and that has helped a lot. With the ending of masking, especially in the schools, do you think that that's going to have an impact on, the number of cases? Will we see another kind of mini spike because more people are just not masked?
Well, we may see more transmission, but I think we need to shift to really looking at what is our goal in control here. And while we're never going to prevent all COVID-19, our obligation is to make sure people don't get sick, so ill that they require hospitalization, intensive care, or that they die. That's what we really can intervene on. And so we may see a spike, but I think we need to watch those hospitalization rates really closely, and act more on those metrics rather than just pure case counts.
And I guess the question becomes, what would your advice be for people who are trying to make their own individual decision? We had this conversation yesterday about masking in clinical and non-clinical areas of our health system. What should people be thinking about as they decide whether they should mask or not mask, whether they should continue to follow precautions?
Well, if you're vaccinated and you're otherwise healthy, you should feel confident that you are protected. But there's always an extra layer of protection that you have the option of adding with the use of a mask. And I think that's a personal decision. And we will see people who will continue to choose to wear masks, especially in indoor areas. And we will see people who will opt to not go with that. And I think as a community, we kind of need to come together and respect each other's choices and make our decisions in that regard. If you're not comfortable being in a room full of people who largely aren't masked, then you should be welcome to wear a mask without feeling like you're going to be ostracized. And I hope that we can all come together to respect each other's rights to protect ourselves in the way that we choose.
I think that is good advice, not just related to masking. One question, so the development of the mRNA vaccines, followed a very long trajectory. It didn't happen overnight, although being able to take the technology and use it to develop a vaccine for COVID did happen faster than typically. But I think there's been so many questions about how the vaccines were developed and was it too fast, etc. This is a new technology that we're seeing may be really effective for a whole host of illnesses going forward. How do you think, as an infectious disease physician, as somebody who's been so involved on a regional and national level in dealing with preparing for this, do you think that we're in a better place now so that the next virus that comes along, if we can quickly come up with a vaccine that's effective, that we're going to have better uptake? Or what do we need to do to now prepare for the same issues that could come out the next time?
Well, the mRNA vaccines were a huge boon, not only for COVID-19 control, but as you said, other potential infectious diseases. We've actually been working on them for quite a long time. Um, and, the reason we've been working on these alternative technologies is that the traditional technologies just take too long to develop a vaccine, and has always been a hindrance in our response to a potential pandemic flu or just a bad flu season. So for many years, we've struggled with this. Now we have a technology where we don't have to grow this virus in eggs and, do all of the things that the traditional vaccine developers had to do that really take many months, and new vaccines may take years to develop. So this is a great tool that I am very hopeful. Another bright spot in the COVID-19 pandemic is what we've learned about how to respond and to different infectious diseases.
I agree, although there are many days when I'm somewhat less optimistic that we've learned as much as we need to.
Always more to learn.
There's always more to learn, and I will say some days it feels like the light at the end of the tunnel is the train that's about to hit us. But I think we may finally be over that now. But that really brings to mind the next question, which is how can we make sure that when the next pandemic hits, because it will hit. We knew this was going to happen at some point in time. I didn't expect it to be during the course of my tenure, but we knew it was going to happen. What else do we need to be thinking about as a community? Because so much of the challenges in reacting to COVID had less to do with the medical and clinical care and more to do with us as a society and the way we think about this, the way we talk about this, the way we talk to each other. What else do we need to be doing now so we're ready for the next one?
Well, whether it's a pandemic or any other type of disaster that needs a healthcare response, I think the better we do with our day-to-day response in healthcare, the better we do with taking care of patients every day who are filling up our emergency departments, the better we will be able to respond. So it really, to me, it's that everyday work, improving the efficiency of healthcare, making sure we're improving access, making sure that we can respond to surges that we see every day in our emergency department and in our hospitals and in our clinics. And so we need to, at baseline, be able to get patients in, be able to take care of the public every day. And when we can do that well, then when something else happens that requires a need for increased capacity, we are much better off in being able to accommodate it. The other issue, of course, that we've all been hearing about is the whole healthcare worker shortage issue. And so we need to start training up some people now. And in the meantime, since we need to deal with this sooner than we'll be able to train people, we're going to have to think of new models of care. How do we deliver nursing care? How do we deliver basic medical care in a more efficient and yet just as safe and high quality manner? That's our challenge.
Well, I would add to that, and this is one that for many of you who have participated in a number of these sessions, there are a lot of healthcare related issues, but one of the things that we've seen, and it became glaringly obvious during COVID if it wasn't before, is that the impact of a pandemic like COVID is disproportionate. It doesn't affect everybody in the same way, and that it's oftentimes people who are frontline workers, people who live in poverty, people of color, who have been most impacted by this. And as we think about, as Connie said, how do we position ourselves to be able to just do what we are here to do as effectively as possible? The other part of the work that we're focusing on is how do we help address some of the social and economic factors that have led to people being so disproportionately impacted? If we can help people come out of poverty, if we can help people deal with those social factors and all of the other things that, again, we learned so much more about during this, I think we'd be better prepared in the future to have conversations, to rebuild that trust in institutions that seems to have been lost over the last number of years, and really be better prepared to help people kind of make their way through this. At least that's the hope.
Yeah, I couldn't agree more. I mean, so we definitely saw disparities, especially early on in COVID, with populations who may be underserved, not have as ready access to medical care, and who work in environments where they really can't socially distance as well. And so the better job that we can do making sure that they're getting the medical care at baseline, they're getting their diabetes taken care of, they're, you know, getting their smoking cessation counseling, that they're doing all of the things that we need to keep our community healthy. That will also help us in any future response, because, you know, anybody who is chronically ill at baseline, for almost everything we've dealt with, they're going to have they're going to be disproportionately affected by these new viruses coming out. And, you know, so we need to put a lot of attention to that. So again, it's just delivering really good health care in general at baseline is so important.
Shelley, do we have any questions on the checkbooks?
We do not.
Okay. So, you know, I want to say thank you so much. I know that Omicron has really thrown all of us for a loop, just from the perspective that it is yet another twist in the very windy road that we've taken to get to this point. I think at this point in time, we're not through Omicron, but we are approaching what I hope will be the end of it. And I'm actually hoping we won't get back to the same normal, because we've learned a lot that I think we will bring forward, but certainly something more closely approaching normal. And most importantly, I hope as a community, as a city, as a country, we have identified the kinds of ways that we were really not prepared. And some of those relate to medical care, some of them are supply chain, some of them are just rebuilding trust in institutions and being able to have conversations and debate and discuss. I am actually fairly optimistic that we'll be better off next time than we were this time, but it may just be that this time was kind of pretty bad, so we have no hope but to be better. I would offer this for any of you who are participating. If you have a question or concern later on, if there's something that we might not have touched on, or that you just think of or comes up in conversation, please feel free to reach out to us. We're always happy to answer questions, to provide whatever information we can. As Dr. Price said, we're hoping that we're seeing a shift to not an elimination of COVID, but to a situation where we're dealing with this on a more regular basis, much like we deal with the flu. That does not mean that it is not serious and that it doesn't have an impact. People die from the flu every year, and those families are devastated when that happens. The same thing is true of COVID. So we really do have a responsibility, not just to ourselves, but to each other, to try to do what we can to help end this as quickly as possible. So if you've got questions, if there's anything that you hear that you're just like, oh, I don't know about that, send a note. You can send a note to me, to the foundation, to Dr. Price. We're happy to answer those questions and get the information out there that will help you make informed decisions about what to do to protect yourself and your families. And I, again, just like to offer my thanks. This has been a tough couple of years for healthcare. It's been a tough couple of years for everybody, but healthcare in particular, and especially the doctors, the nurses, the food service workers, the environmental service people, everybody who is dealing on a day-to-day basis with COVID. People are exhausted, and as I've told folks, they're not burning the candle at both ends anymore, because the candle's completely gone, and people are shouldering on just by the force of sheer will. So thank you for the support that we've had. It has meant more than I think we can ever tell you, and we look forward to being a resource for you and for your families and businesses and whoever else needs us. So thank you very much, and please feel free to reach out at any point. So thank you.
Thank you.